Using a logic model to guide program design and activities. My name is Awa Kone, and I'll be facilitating today. And the presenters will be Dr. John Blevins, Dr. Mimi Kaiser from Emory University, and Dr. Jill Olivier from the University of Cape Town. And just to let you know, at the end of their presentation, there will be a discussion section for 15 minutes. In the meantime, if you have any questions during this presentation, on the panel for webinar, GoToMeeting or GoToWebinar, at the bottom you'll see a chat box. Feel free to ask your questions directly to the host, and it should say Karen DeLuca. So if we have any more, we'll just get started. John?
Hi, thank you, Awa. And greetings to everyone who's participating in the webinar. Either good morning if you're in the United States or on the US East Coast, or good afternoon if you're in other parts of the world. We're happy to welcome you to this webinar. My name is John Blevins, and I am the director of the Interfaith Health Program at the Rollins School of Public Health at Emory. And the Interfaith Health Program is one institutional partner in an academic consortium that's part of the UNAIDS PEPFAR joint initiative to strengthen faith-based partnerships. There are a number of implementing partners in the initiative, and the academic consortium is one of those implementing partners. The Interfaith Health Program is honored to carry out this work as part of the academic consortium in partnership with the University of Cape Town, and you'll hear from our colleague Jill Olivier later in the webinar, and with St. Paul's University in Limuru, Kenya, which is just outside of Nairobi. As the academic consortium in this partnership, one of our responsibilities is to work with other implementing partners to help them and their local collaborators to build capacity to better understand the priorities and the expectations of funders such as UNAIDS and PEPFAR, and how they can describe their contributions in addressing those priorities. In short, implementing partners ask the academic consortium to help them to understand, how do we, as faith-based organization, speak the funders' language? Could I get the next slide? And so as part of that, the academic consortium has designed a 4-webinar series, and this is the first one. This webinar series consists of 4 webinars. Today's is using a logic model to guide program design and activities. On December 4th, we'll have a webinar on designing program to demonstrate impact. On February 5th, we'll have a webinar for faith-based health facilities and systems on generating evidence on the distinctive of FBOs in the HIV response. And on March 5th, we'll have a similar webinar in terms of content, but with a focus on either national levels or smaller level non-governmental organizations or faith-based organizations or local religious communities. So webinar 3 will focus on clinical models of care that faith-based health facilities carry out. Webinar 4 will focus on community-based models of care and support. I'd like now to ask our speakers to introduce themselves. We'll start with Mimi Kaiser.
Greetings, everyone. My name is Mimi Kaiser, and I'm an assistant professor here at Emory at the Rollins School of Public Health, and work with my colleague John Blevins and Awa Kone in the Interfaith Health Program. I teach religion and health courses, interdisciplinary courses, to theology and public health graduate students. My work in the U.S. and globally is primarily community-based leadership and partnership capacity building across the sectors of public health and faith-based organizations. Colleague Jill Olivier from across the pond. Would you introduce?
Hi, good afternoon. Hi, my name is Jill Olivier. I'm an associate professor at the University of Cape Town in the School of Public Health and Family Medicine, in which I'm in the Health Policy and Systems Division. I think I'll stop there, John.
Great. Thank you, Jill. Before we begin, I just want to identify the learning objectives for this first webinar, and they are 3. You see them on the screen in front of you. The first is to describe the key components and the theoretical assumptions of a logic model. Dr. Kaiser will be leading us through a presentation on that objective. The second is to assess organizational capacities in relation to feasible interventions that an organization can carry out informed by a logic model. I will be leading us through a presentation on that objective. And the third is to apply a logic model to a case, and Dr. Olivier will be leading us through that material. So I'm going to turn it over to Mimi to start with objective number 1.
Greetings. Again, my role in the webinar is to introduce you to the logic model, its key components, and theoretical assumptions. So a logic model, the next one, next slide, please. A logic model is like a map of a work project. It's a visual representation of inputs, activities, outputs, outcomes, and impacts of a program or a project. It's a framework for describing how program elements work together to reach its goals and objectives. Its 3 attributes are it's a layout, like a map, a pathway that shows the causal relationships of the core elements and how the program works. It's logically sequential. It's built to describe if this occurs, then this happens as a result. It's a tool for facilitating planning and program project execution. And it's a tool for communicating project and programs to internal and external stakeholders. Its uses, next slide, and benefits. Quite a bit of the benefit of a logic model comes from the process of sitting down together to do the planning and program development. What do we need to do to get the results we want? It's also an important aid in communicating to key stakeholders how the program is being accomplished. And it can also serve as a basis for an evaluation plan for monitoring and learning about what's working within your program or project. Next slide, please. So let me describe the key components of a typical logic model. There's some variations, but these are some of the common core components that build the logic model and help you link your goals and objectives to planning and evaluating what you can accomplish. So the first one is inputs. Those are the resources used for the program, things like money resources, people, their expertise, different tools, things like a curriculum or different organizational resources. So a lot of different kind of resources are considered as you think about what you need to accomplish. What do you need to accomplish it with? The second common element is activities, the processes or actions carried out, such as trainings, different kinds of interventions, services that might be delivered, whatever is going to bring about the kinds of actions that will bring about the desired results. The third component of the logic model are outputs, tangible, direct results of the activities. Number of things produced, like persons trained or served. The fourth component in this sequence of relational causal elements is next is outcomes. So from the outputs, you are most likely to produce, you plan and anticipate, you are most likely to produce these outcomes. And these are sort of the key intermediary changes. They could be short or long term. They're usually changes in knowledge, so gains in knowledge, changes in behaviors or practices among those who participated or benefited from the activities that you conducted. And then lastly, more long-term are impacts, and these are population level. So, such as new cases of a disease in a population. So these are the kinds of things that you would expect if you can evaluate out into the far enough out into the future, the long-term, more larger scale kinds of impact that you would have. So next slide, please. The logic or theory underlying the model is that if these kinds of resources and activities are used to conduct the work, then outputs, outcomes, and impacts are likely to happen. So keep that in mind as sort of the core underlying rationale that undergirds the logic of moving from the left side of the model, the intervention side, into the future to what creates the impact in the future. If this occurs, then likely these kinds of things will happen as a result. Next slide, please. You will often see the components organized in this way. So moving from the left to the right, you'll see your inputs, the activities, moving with the arrows, because the arrows depict the causal influencing relationship between each of the components as you move into the future towards outputs, outcomes, and impacts. Last slide. So this is perhaps something that you can't read. A lot of small print here, but I'm going to highlight a couple of the elements of this and show you the relational dynamic of these components. On the far left, this is an example of some work recently that we undertook with the Christian Health Association of Nigeria. As we were working with them in their planning of curriculum design and setting up appropriate evaluation activities for the curriculum, was a curriculum to reduce stigma and discrimination, HIV stigma and discrimination in healthcare facilities. So two of the key inputs that we noted at going into the planning of the project were the in-country resources from the Christian Health Association, UNAIDS Nigeria, NACA, the National AIDS Control Agency, their NASCOP, the National Faith-Based Working Group, and NINRELA, the Nigeria Interfaith Network of affected and infected religious leaders working against HIV/AIDS. And then key to this were curriculum content sources to use in the development of the curriculum, as well as the national policy information used that was going to be important to frame the curriculum design and shape what the learners needed to frame their learning. So the next column in activities was to assemble the curriculum content, develop the curriculum and the evaluation planning tools, and as part of the activities, actually conducting the training of trainers for the health facilities and training and religious leaders, healthcare workers and religious leaders. The outputs of this were healthcare worker and religious leader curriculum, so that was the product that was created. And then also the output for that was the number of persons trained in the training of trainers at the facility level. The outcomes were knowledge and skill increases and attitude changes, and the action plans that they produced out of the training of trainer curriculum and experience. Also, each facility developed one of the outcomes you would expect as the trainers return to their facilities was the facilities conducting a code of conduct, developing a code of conduct. Hold on a second. Developing a code of conduct for and possibly a facility self-assessment tool. Then finally, the impacts from this, if you could think long-term in population level, would be consistent facility adherence to these codes of conduct, the policies that were set in place. They would be reporting those back. And then even further into the future would be the optimal long-term impact would be a reduction of the viral load of those infected because of increased access and a different kind of environment in the health facility that was set forth in the expectations of this planning process and the curriculum design. So in summary, a logic model is a tool for your program and project planning, for communication to stakeholders, for evaluating effectiveness and learning what is working and what might need to be changed. You'll see at the bottom of this last slide, there are different points in the process of the logic model development that help you see where it's important to evaluate and set up methods for documenting and measuring what happens as a result of each of those components along the process of the project timeline. So I'll next turn it over to my colleague, John Blevins, who will take us further in learning about organizational capacity related to the use of this. Thank you.
On assessing organizational capacities. Next slide. So your logic model informs a program or an intervention that your organization is carrying out. The question to ask yourself from an organizational perspective is your organization a good fit for the program that is the logic model represents? Organizations develop programs internal to their own organization. They develop their own initiatives as part of their work. And then organizations also access funding from outside funders to implement a new program or a new intervention. And in regard to assessing your organizational capacity, there are a number of questions that can be helpful for an organization to ask. Does the program align with your organization? For programs internal to your organization, a process of asking yourselves, is this program a fit with our organization's vision and mission? Is this something that furthers what we understand ourselves to be up to as an organization and the kinds of commitments we have? Second, do we have the resources to implement the program we're proposing or developing? Are we planning and implementing in the right mix of realistic assessment of our current capacities and an aspiration to the kind of organization we want to be and the kinds of programs we want to be carrying out? Logic models are often carried out mostly with in regard to programs initiated from outside funding, because many times in seeking to secure outside funding, a logic model can be useful for helping you to articulate to a funder your proposal for what you want to do. So assessing your organization in regard to outside funding can be helpful for thinking about developing a program that's feasible for your organization to carry out. Seeking outsider funding is a way to maintain or to grow your organization, and that is a difficult thing to do in the current funding environment and in the current environment of service delivery. And so there's both a lot of competition for funders' dollars, as well as a big push on the part of organizations to secure funding as a way to keep doors open and to keep programs healthy. And so the challenge for an organization is to assess whether a potential funding stream is actually feasible and whether it actually aligns with an organization. Are the funders' stated objectives and deliverables realistic for your organization? Do they align with your organization's vision and mission? One of the things that's distinctive about faith-based organizations, both service providers and local religious communities, is the way in which mission and vision of the organization is articulated. And it can sometimes be difficult for faith-based organizations to articulate that distinctive in a way that resonates with funders' priorities and funders' objectives for what they want to achieve with a particular funding source. So it's important for your organization to be able to assess the alignment, and then to be able to articulate it and communicate it to a funder. So there's a fundamental question, first of all, in regard to your organization's vision and mission and its relationship to the priorities, the goals and objectives of the funder. The second issue to assess is, do you have the capacity to carry out the work? What are your inputs, thinking along the logic model, what are your inputs that can lead to the outputs of the funder? And is there a match between the inputs that you have and the funder's expectations? One of the reasons that funders such as PEPFAR and UNAIDS are strengthening partnerships with faith-based partners is because of the reach of faith-based organizations into local communities and the longevity of faith-based partners in those local communities. And so there's a real benefit on the part of funders to build and strengthen those partnerships as they exist. But one of the potential pitfalls of such kinds of capacity building initiatives and partnership initiatives is the requirements and the priorities of the funders can sometimes gulf or overwhelm a local organization on the ground in regard to expectations or requirements from large-scale funders that local grassroots organizations don't have the capacity to carry out. So it's important to assess your organization's capacity to carry out the work in regard to your inputs. Next slide. So to do that, we want to think along the lines of a program assessment. Are the program outputs feasible for your organization to carry out? What does your organization possess in regard to inputs in order to be able to carry them out? What kinds of inputs will your organization contribute? They may be programmatic inputs. You may be able to carry out important services such as HIV service delivery and clinical care. And you may be doing that in a place that government programs or civil society organizations don't have a capacity or as much of a relationship and capacity to carry out. You may have personnel inputs that are distinctive. The distinctive roles of religious leaders and directors of religious organizations and faith-based organizations to speak in the language that resonates with the priorities of local communities is a distinctive contribution. And so your personnel capacities may help your organization to contribute to the outputs in important ways. You may have reach to certain communities and certain populations. You may be able to provide services to those who are socially isolated or who don't have as many economic resources. And so you can reach important components and of the community in ways that other organizations cannot. You may have partnerships that are important to build between government, civil society, and your contributions as faith-based organizations. And you provide an important component to a robust partnership across sectors. And then you may be trusted organizations or institutions in local communities that have a reach that other kinds of organizations, such as governmental organizations or civil society organizations, don't have. So you need to assess your inputs both in terms of programmatic and administrative capacities, as well as less tangible or qualitative characteristics such as reach and trust. If the deliverables require new capacities for your organization, the question to ask yourself is, can you reasonably achieve those new capacities, or are you setting yourself up for failure? There are numerous instances of funders with an expectation and a sincere desire to build partnerships with organizations on the ground as a way to reach down to more local levels. But the requirements from the point of view of such large-scale funders are completely unrealistic for a smaller scale local organization to be able to carry out. And so you have a responsibility and the role of assessing your current capacities and whether you can build capacity to meet the expectations and the requirements for the funder. You don't want to pursue funding and to get it, and then to find that such funding requirements actually set your organization up for not being able to carry out the work in regard to the funder's expectations. What are your distinctive contributions and how do you communicate them to the funder? I've already alluded here that there are some distinctives in regard to faith-based organizations, and in webinars 3 and 4, we'll be discussing that as the focus of the topic, so I won't speak more about it here. I'll only say that being able to articulate faith-based distinctives is important, but you have to articulate them in a way that demonstrates their impact in the language of the funder, which can be done through assessment of inputs from a logic model. And if the program that you're seeking to implement would require your organization to stretch, would the capacity building that would be required grow your organization in the right kinds of ways? Is it in alignment with the vision and mission of your organization and the current objectives of your organization in regard to its activities and priorities? Or is this a funding stream that takes your organization into places that it currently isn't working, and is that something you want to do? There needs to be an assessment of the fit or not between funding and your organization's mission. And then to speak to the question that Minnie raised a moment ago, which is the evaluation of outputs. I want merely to note right here that this will be the focus of our next webinar, where we'll talk about the relationship between outputs and outcomes in the logic model and how those can be evaluated. But there are some issues I want to just raise today in addition. Evaluation planning needs to be part of program design throughout the process and not something you consider merely as the last step or once your funding is in place and the program has begun. A lot of times funders ask organizations to think about ways to demonstrate and to measure impact. An impact evaluation cannot be feasibly conducted unless some processes for earlier evaluation are being carried out in relation to your outputs. So the places in Minnie's presentation, where at the bottom of the slide you noted different points of time for evaluation, are important to consider in regard to your overall evaluation plan. I want to give an example of that on activities that the UNAIDS PEPFAR Joint Initiative has carried out. And that's the Interfaith Pre-Conference that occurred prior to the International AIDS Conference here in Amsterdam in July of 2018. The academic consortium worked with the Ecumenical Advocacy Alliance, one of the UNAIDS PEPFAR implementing partners in the initiative, and the organization that carried out the pre-conference to develop an evaluation plan. And there were elements of process evaluation, which was simply to understand the people who signed up, the people who participated in regard to their roles in an organization and who was represented among the audience, to understand general kinds of assessment of the event itself from those participants, whether participants found the content useful and helpful. That's a process evaluation. There were outcome evaluations in regard to noting change in knowledge, change in attitude, change in intended behavior as an outcome of participation in the conference itself and going to plenary sessions and breakout sessions in the conference. And then finally, in the coming weeks and months, we'll be conducting phone interviews with a random sample of participants to understand from them to what extent they've actually taken the information they learned and the knowledge they gained to have an impact on how they do their work. That's an example of an impact evaluation but that impact evaluation can't be carried out in isolation from earlier stages of evaluation, such as process and outcome. The question for your organization is to assess what kinds of evaluation needs to be carried out, and what can your organization feasibly carry out in regard to that evaluation. What are the metrics for your assessment? How will you plan for evaluation activities? And how do you determine the right time and the right process and right method for conducting a process evaluation, an outcome evaluation, or a longer term and larger scale impact evaluation? As I noted, we'll talk about that more in webinar 2, but I only wanted to say for this webinar that that question is an important one to consider in program design, because you need to think about the relationship between inputs, outputs, and activities in relation to your evaluation plan. Next slide. So I'll turn it over now to Jill to walk us through a case study of a real life example and how to use a logic model in regard to that.
Great, thanks, John. Thank you everybody for hanging in there. I know these webinars always are something of a challenge. I actually have a version of webinar bingo where every time I've been working on. So can I just get a check? Has everybody got a piece of paper and a pen? Yes? I'm going to take silence. I'm going to take silence to mean yes. Okay. So I'm going to give you this particular case, and this comes across really commonly in a number of different settings at the moment. This is the logic that's being run. So there's a problem in rural settings with women who have too many children and too closely together, which impacts poorly on maternal and child health. And this has been a problem that's been recognized in many different settings, and this has impact both on child health and on the maternal health. And there's an idea that if you work with religious leaders who we understand are very influential in their local communities, that you can spread healthy messages about birth spacing from religious leaders to their congregations, to their broader communities, and this will improve this issue about maternal and child health. So, as an intervention, team or program, you decide to train local facilitators and run workshops with these religious leaders, utilizing specific religious texts, so localized theology, combined with good public health messaging on birth spacing. And you decide that you will count the number of people that will attend the workshops and get them to answer a brief questionnaire about whether they've been influenced by the workshop and whether they plan to spread the messages in their local congregations. All right, so I'm going to take a 10-second pause and ask everyone to try and fill in at least one line of a logic model on this. So I will give you some clues to start off with. The impact at the right-hand side is the maternal and child health. And the activities are running the workshops and training local facilitators. Okay, and I'm going to take a couple of seconds just to see if you want to try and bend your brains a little bit on how we get from the left-hand side to the right-hand side of this logic model. Although I know that dead air on radio broadcasting is a bad idea. Okay. So here is the next slide, is what you most commonly see on the logic models of these types of interventions, okay? You see a series of inputs, which are things like support for the facilitators. You see inputs such as financial support for running workshops and developing materials and developing the curricula. And you see financial support and input around research and M&E. The activities are usually around training of facilitators, running the religious leader workshops and some kind of surveillance or monitoring. And this is when things start getting a little interesting. So then you start having in these types of logic models that honestly are being run in hundreds of different settings around the world at the moment. You will have the outputs being effectively run workshops. And then you start having things like outputs that are religious leaders who now have knowledge about birth spacing. So their knowledge will increase. The idea is that their attitudes will change towards birth spacing. And not only that, but their behavior will change. So they will now be motivated to go and spread this knowledge and attitude change to their congregations as well. So then you move right to the outcomes, and there is a hypothesis about what we call a cascade effect, with the idea being that the religious leaders outside of the workshop will now go and share this knowledge, attitude, and behavior change with their congregation. The congregation will then share this with their community, and this change will take root in the community, resulting in, which you probably can't see on the right-hand side of the screen, improved birth spacing in the community, and ultimately improved population scale, maternal and child health indicators. Now, there are some obvious challenges with these kinds of models, and the thing with the logic model and is the connections between these things, is the ideas that are sitting underneath some of these words that are in the box. So this particular logic model has some particular stress points. So those stress points are things such as the idea that through a workshop you can increase someone's knowledge, change someone's attitude and their behavior through a targeted workshop. The idea that if you ask someone their perception at the end of a workshop, like, has your attitude changed? And they say yes, that this is an actual effectively changed attitude. There have been huge challenges of KAB, knowledge, attitude, behavior change models in the last decade, especially with things like HIV and AIDS, where we have shown in many settings that you can increase a community's knowledge about HIV, but that won't necessarily change the behavior. So there's quite a lot of assumptions going on in this model, okay? But the assumptions also going on with regards to the cascade about how this is now going to shift into congregational scale, community change scale, and ultimately actually affect something as personal and private as birth spacings. A couple, a woman, a couple, a cultural decision when to have children, and with regards to things like, obviously, like with a combination of factors such as reproductive health issues and prevention issues. And in this particular logic model, it's the little arrows that are actually almost most important. It's the arrows that hide some of these hypotheses and some of these understandings about how these things are going to actually move from one side to the other. So how do we move from the workshop with religious leaders to improved population scale maternal and child health indicators? And very often it's the scale of the activity not necessarily matching the scale of the impact, and that's very often where things do become problematic. So I just thought it might be interesting just to give you an example. This is an actual logic model from a HIV prevention program. And I just thought it might be, I haven't even named it here because I think it's useful just to have an idea that we've been talking through the basics and the logics and the connectors. But logic models tend to be much more elaborate than these ones that we've been thinking through. I mean, generally there are multiple streams of activities that are supposed to be connected to and merged together to an ultimate endpoint. So this one, for example, there are 6 levels of intervention, multiple levels of outputs and effects down to an improved prevention indicator. So this is it today. I literally wanted to just kind of get our heads around the idea that it's not the simple kind of one step to the next step. step, but actually it's multiple. Logic models generally look like multiple interconnected steps, and it's that understanding that interconnectedness that's really important. And the other thing I wanted to stress was, I think as we all know, and reading some of the questions that have been coming through, is that yes, there's the logic model and then there's the reality, right? And that is why, so this is from some teaching work we do in health systems work, and this is just to say that, you know, when you implement any kind of logic intervention into a complex adaptive system, you're going to have unpredictable pathways, you're going to have things going in reverse. So in a sense, it's just being realistic about that. And that is why things like theory of change, one of the questions was about TOC, and that is why theory of change has become so popular at the moment, is because it takes that complexity into account. And what it says is that what a logic model really is the roadmap for how you understand the logic, but that logic model is possibly going to have to change along the line of many and most interventions. So yes, it's a graphic depiction. It's really important to understand, as John and Mimi have been talking to. It's a really useful tool. But very often in the worlds that we are working in, it's the understanding that yes, we live in highly complex worlds, and this linear logic of how things should work, very often you'll find that many of those connectors just don't work out as you had planned, or some of the logic is faulty in some of those logic models, or some of the expectations for the scale of effect, population scale effect, might be overblown against the size and scope of the activity in the beginning, which is the example of the case I gave you earlier. So it's a sort of like, there's the idea and the understanding and a very useful tool, and then there's the real and the application and the intervention. But still, it's part of the it's a logic models are extremely useful, and they are a useful starting point. And then you have the more elaborate approaches such as realist evaluation and theory of change approaches, and all of these kinds of other approaches that are now trying to pull in the complexities of the world that we are living in. I'm going to stop there and hand control over to John, I think.
Thank you, Jill. So I know that David and Jill alluded to this. David and Gabriel both had questions regarding the logic model. I'll ask David's question first, which is there necessarily a line-by-line if-then connection in the chart that shows inputs and activities? David, I'm going to unmute you. Do you have a follow-up to Jill's response?
Yeah, I think the slide number 16 gives the answer, because the arrows, the little yellow arrows, don't necessarily go line by line, but in fact it's more complex. Multiple things on one side could lead to multiple things on the other. And so that was the question, was whether it was necessarily just a row by row, and slide 16 shows it. But while I'm unmuted, let me make a comment. In some of the work we did with stigma in local faith communities, we actually tried to implement a mini logic model inside one of the outcomes, so that the result of the training, I'm looking at the one that says RL share K, be the congregation, and so on. That little box ended up being that each local congregation did its own little mini logic model. What activities they're going to do, what outputs, how are they going to measure? And that, I mean, I can't say it was totally successful, but that was a place where we tried to apply the logic model.
Yeah, this is Jill. I mean, David, that's absolutely correct. And I think in a sense, you know, when you start thinking about logic models, and in the webinar format where we're not sure how how advanced everybody is in the thinking, we show the simplest version of things. But I think that kind of version where you have little pieces of logic within a broader logic model is absolutely the way that many people are moving towards. I think overly simplistic logic models, while useful for tracking and understanding an overarching intervention, very often cause as many challenges as you know, if you kind of forced to stick to them. So that's my response to that. John or Mimi?
I would add to what Jill and David have just been saying, in that David's thinking about embedding the logic model was similar to what we did with the training with Chan in Nigeria, in that became, as we thought through how to demonstrate in the training of trainers and how to achieve an outcome based on the training that showed the capacity of the trainees to go back to their organizations and implement activities, is we then built in as an evaluation measure and a curriculum measure their work in the last session on the development of an action plan with sort of logic model or action planning components to it, so that became both a measure of an outcome, but also something that could track outputs into the future.
Yeah, we used to call our workshops action planning workshops, so totally aligned with that.
One of the things that a number of global funders, and I'm thinking here specifically of PEPFAR, do in relation to this connection between larger scale theories of change as well as planning at a macro level as an implementing partner, and work on the ground at the local grassroots level, is they provide a tranche of funding to a partner for capacity building at local grassroots level. So seed grant funder, which then has the role and responsibility to fund local grassroots initiatives that develop a logic model related to work on the ground, like you were talking about, David. So I like very much the way that you think about the ways to apply a logic model at higher levels, as well as breaking a specific activity out and developing a logic model related to it. And large-scale funders have similar kinds of processes built into their platforms for doing something along those lines as well.
Thank you, everyone. We'll go to Gabriel's question, and Jill also touched upon this. Gabriel wanted to know, or to clarify on the links and differences between a logic model and the theory of change and project proposal. So Gabriel, I will unmute you if you want to add anything to your question as well. Can you hear us, Gabriel?
Yeah, thank you so much. Nothing really to add, but just to say that sometimes we get it mixed up because the logic model, the way it's presented, logically geared towards specific outcomes, and of course, leading to the impact. And the theory of change in any project tells us in what way we envisage to have the change in terms of what we do. So I was just trying to have a better understanding how the two go together in a particular project proposal or a project implementation. Having said so, also, I just wanted to, looking at this logic model, to say that the sequential presentation and framework in which it is presented assume that when we are implementing activities, when we are putting together the inputs, we also envisage that some assumptions are made, and those assumptions presupposes that anything that can negatively impact on the project is addressed. I don't know whether that is envisaged or not, but that's just my add-on. Thanks.
So Gabriel, this is Jill. Those are all really interesting observations, and I think absolutely correct. I think the one thing is we all use this language differently. I work with World Vision quite a lot, and World Vision uses theory of change almost interchangeably with logic models, so I think there's institutional understanding of this language. But I think in my understanding as well, theory of change is about, it's not about the diagram, it's about the process. It's about a process of bringing stakeholders together to understand the shared assumptions and to clarify what those assumptions are. So it's really about this ongoing process of surfacing these assumptions, because very often what I find is, especially with logic models, is you'll find that one part of the implementation team will design a logic model. Another part of the institution will be trying to monitor and evaluate it and set certain indicators on it. It might be totally different to what the people that are implementing it understand that they are doing. So in a sense, logic models sometimes get torn apart between various interests and various interests. So I don't see a theory of change process as being different. I just think it's exactly what you were talking about in your second observation, where a theory of change process is about that process of ensuring that we've thought about the unintended consequences or the possible negative effects, or the trying to understand and make sure that everybody really has the same understanding of what they are doing and why they're doing it in that way. But all part of the same process of trying to wrestle through and ensure that we're having the best impact in a healthy way.
Okay. Yeah, great. Thanks.
Gabriel, I also liked your description of anticipating consequences of activities and thinking about the challenges related to implementing a program in regard to barriers to that implementation. And some of those we can anticipate, and others of those only are made plain as the process is undertaken. And so I think the idea of the necessity of adapting a theory of change or a logic model based on what we're finding in regard to evaluation is always important, and a really key process. One of the things that I feel I often do in regard to using logic models is I may be overly optimistic in regard to what will accomplish in regard to this issue of inputs and activities that can be carried out. Because at the community level, there are other kinds of inputs that are impacting perceptions of the program and perceptions of the issue that we're addressing in general through the program. And those inputs, which aren't part of what we're bringing to the table, are also going to have an impact in regard to programs and the outcomes that we are looking to achieve. And so we've got to assess those, and a lot of those we're not going to even know about until we begin to carry out the work ourselves. And so I think your idea of prospectively thinking about challenges and barriers is important, and also responsibly addressing them as you begin to spot them once the program is carried out. And I do think a strong logic model structure can help you to do that.
Yeah.
Can I just jump in, John? Sorry, I don't want to dominate, but I was also just thinking, and this is potentially slightly controversial comment, but I was thinking about, John, what you were talking about earlier about, the need to negotiate with funders as well. And I think there's something about logic models being really important as a tool to be able to negotiate with funders and to manage funders' expectations. Because it's true that many funders have their eye on the population scale long-term impact. But I think it's really important that program staff and implementation staff have a strong enough understanding of the logic to be able to push back on funders and say things like, if you're looking at this particular logic model, saying things like, you will not see birth spacing change within 6 months of this workshop being run. To using it as a pushback on funders to say, yes, this is what we're looking for, but maybe we actually stop the evaluation at the outcomes level and we don't go all the way to the impact level. So there's something about using a logic model to test funders' understanding of what impact their money will see and what can be proven through evaluation, and I think it's quite useful for that too.
I agree, Jill, and I'll give a real life example of that in the work of the academic consortium related to one of the things that PEPFAR and UNAIDS asked us to carry out, and that was to build the evidence base on the contributions of the faith-based sector for HIV services by a secondary analysis of health delivery data. We were able in the first initiative related to that, the first activity related to that, to quantify the contributions of the faith-based sector in Kenya. But the funder asked us, well, that's great. That percentage gives us something to quantify. It gives us a quantifiable way to understand that. But how do we understand whether or not services offered by faith-based health systems are a comparative advantage in relationship to government facilities? That is an entirely different set of activities and far more complicated and far more cumbersome from an assessment perspective. And by working through and talking about the kinds of inputs that would be necessary, the kinds of organizational capacities and relationships between the academic consortium and country partners, the kinds of work that would have to be carried out in terms of activities to be able to actually do that comparative assessment, and the burden of carrying it out, we were able to demonstrate to PEPFAR and UNAIDS, that's a great question, but it's not feasible for us in this time frame for this project to be able to do that kind of comparative analysis at a national scale. So you're exactly right that being able to talk within the frameworks of these dimensions and these domains back to a funder can be really important.
I'd like to, this is Mimi, and Gabriel, thank you for your question. I wanted to add to that as well, so it's a little different than where John was going. But to say that a logic model, as we've described it, does represent a theory of change, but the process for developing that theory of change actually begins at the very beginning of the proposal response or project planning, in that how the goals and objectives are set up. And the logic model helps you further detail the specific steps and outputs from that are built on a theory of change that's the likelihood that what you're aiming to do is gonna produce the outputs and outcomes that you want to, that you're accountable for, or that your funder is expecting. The strength of that likelihood is enhanced when evidence-based interventions or evidence-based materials that have already been tested and shown to produce certain outputs and results are used in your design. So, for instance, in the curriculum work in Nigeria, we drew from existing curriculum materials that had already been implemented and evaluated in 6 different countries and shown to produce knowledge and attitude changes. So there are ways that your theory of change and the logic embedded in the model can be strengthened. The likelihood of producing those results can be strengthened when you draw on intervention research that has been shown to make the difference that you're claiming to make.
Thank you, Mimi. And I believe David had his hand raised. So David?
Yeah, just one more comment, and that's that if we look at the impacts, there are maybe a lot of other factors that influence the impact. So it's not just whatever outcomes we have produced, but other things. And so it may be hard to quantify, the degree to which our outcomes have caused or influenced the ultimate impact.
Yeah, I mean, that's exactly correct. The causation onto the population scale impact is always the massive challenge. And you'll never be the only intervention working on that. So that's why, those larger scale, much more expensive impact evaluations you know, are kind of where you start working on that to try and understand the causation. But I think it's still, you know, there's a difference between saying we have to show the only impact and then it's different from that to saying, you know, this is ultimately what our intervention is trying to do. You know, where we're trying to have impact. I think there's a slightly different, you know, message between that.
Yeah.
But I absolutely agree with you. And sometimes that requires pushback too, you know.
I also think that if you developed evaluation elements related to outputs and outcomes, you can speak back to a funder related to the impact on a program not being what was initially conceptualized based on these kinds of outside factors by demonstrating in regard to the process that was agreed upon at the beginning of the program, your evaluation on outputs and outcomes demonstrates that you met your objectives and these other factors were beyond your control, or maybe you anticipated them, but you don't have the capacity to completely manage them because you're working in real life where things are complicated. So your earlier evaluation elements help you to speak back to the challenge of an impact evaluation.
Right.
Well, thank you to everyone. We're now going to try to wrap up this webinar. Karen, if you can forward, thank you.
So thank you, everybody, and thanks for the really good questions. Today, we worked to introduce a logic model and to provide it to you from the kind of framework that we see it as a resource for program design and development, not as the final answer, but as a potential resource for you as you begin to develop programs and to think about feasible activities. We focused on the assessment of your organization's capacity to match expected deliverables and outputs, specifically those that are required by a funder, and for you to be able to use a logic model to match your capacity to a funder's expectations. In webinar 2, we will continue the use of the logic model as a framework, and in it we'll examine the relationship between outputs, outcomes, and impact, and discuss ways that your organization can develop evaluation processes to measure those outcomes in relation to impact. And so we'll talk about different methods and uses of evidence and different methods for gathering evidence in regard to evaluating outcomes and a larger scale, longer term impact evaluation. Just as a reminder, that next webinar is on Tuesday, December 4th. At this same time, we encourage you to invite colleagues within your organization or other colleagues to join us for that webinar. As a reminder, this webinar is being recorded and people will be able to access the content for this webinar on the IHP website and after today as well. So these webinars are free of charge, but registration is required. You see now at the bottom of your slide the URL for the website for registration. It will also be the place where recorded webinars and other material will be uploaded. That reminds me about other materials. Jill, can we upload the PDF that you named in your response to Gabriel? Can we include that on that site?
It's a different document, John. I think just the link is fine.
Okay, great. Yeah, just the link, but as a resource for participants.
Yeah, sure.
Great. And so finally, I just point you to the learning objectives that for webinar 2 that are listed here. We'll be describing the flow and causal relationships across the logic model with a focus on defining outputs, outcomes, and impact. We'll be describing methods, both qualitative, quantitative, and mixed methods approaches for measuring outputs, outcomes, and impact. And then we'll again apply these ideas and this conceptual framework in a case application to think about how this would happen in real world program implementation and in program activities. And identify ways in which capacity can be built for demonstrating evidence. You've got to build this capacity for your funders. How can the capacity that you build in that regard also be a resource for your organization itself, and not just to further funders' needs and priorities, but actually strengthen your own program intrinsically? Thank you so much for your participation and for your good, strong questions. We appreciate all that you're doing, and we look forward to seeing you next month.